Dr. Sabrina Siegel with the Neuroscience Education Institute, and twice a month, I sit down with a renowned mental health care expert to discuss breakthroughs and best practices for treating patients with mental illness. In this episode of the NEI podcast, I'm so excited to bring back one of our former guests, Dr. Kojo Sarfo. He is a DNP and a mental health care provider, and he is very influential on social media, especially the platform TikTok. And today we are talking about debunking TikTok trends on mental health. Welcome, Dr. Sarfo.
Thank you for having me. I appreciate it.
Absolutely. And before we get started, I just want to congratulate you. Dr. Sarfo just reached 1 million followers on TikTok. Congratulations.
Thank you very much. It's very exciting.
So it's so inspiring to have someone like you who does have the knowledge and the background and the expertise and the credentials in mental health, who's actually very passionate about spreading awareness and positivity surrounding mental health conditions and issues, especially in the adolescent community, and to do so through something like this extremely popular platform, TikTok. But we know that there are many profiles out there that of people who don't have this background, this education, this expertise, or these credentials. And it could be anyone from kids to, adults, but they're spreading misinformation about mental health. And I'm excited to talk about this with you and to address this very important topic today. And so my first question for you is, what are your thoughts about the recent mental health trend on TikTok, the 15 minutes for me test? Is this dangerous or helpful? What are the positive and negative consequences surrounding self-diagnosis programs for mental health?
As it is with almost everything in life, there's pros and cons to anything that pops up online. I think because we've had such a hard time generating a conversation around mental health conditions and awareness and even getting people comfortable to where they can go and receive help. It's so hard to do that. So anytime you can get the conversation started, you can look at it and say that it's helpful. So like something like 15 minutes for me, like it gets the conversation going, and somebody who is looking for a program like that, or somebody who's interested in things similar to 15 minutes for me, they're already having the kind of questions in their head that lead them eventually to going to get a psychiatric evaluation from a provider. Because if you go online and you're taking a self-test and you're trying to ask, am I anxious? Am I stressed? Am I burnt out? Like when you ask those questions, there's a good chance that even if that isn't the issue, that something is going on. So the fact that it gets you to initiate the conversation is good, provided you understand that any type of questionnaire or screen tool online is not like a diagnostic tool, and it's there for purposes of making things easier for us as providers. So that way, if you take it, then you're like, okay, I think this is, this could be going on, or that, like you start to have like a running list of potential conditions in your differential list in your head when a patient does a questionnaire. It makes things easier for you, but you still have to go through a comprehensive evaluation, get history of present illness. You have to get background information, collateral information. So a lot goes into a diagnosis, and it's not just like a self-help test or a questionnaire online. There's you can't get diagnosed. No, you cannot get sufficient diagnosis in 15 minutes. So as long as people know that, that's the purpose, is to get the conversation going. But like the downside is people can self-diagnose, and then if they can't afford proper health care,
right.
If you believe that you have a certain thing, then you go online looking for remedies, and you want to be your own doctor. And so that's the downside to that.
And I think you touched on it perfectly. So the positive seems to be if people are understanding that this is opening the door to awareness in mental health, and that means, okay, now you follow up with a mental health professional,
right?
And it's a positive thing. But if you're using it just to close the door once you've noticed certain issues or conditions that might be going on in your life, and then you're searching either further on TikTok or Google or whatever for self remedies, that could be more harmful than good.
Yeah.
What do you think the purpose was behind this 15 minutes for me? Why do you think this got started?
I think the purpose was to, because honestly, in this country, like if you want to go see a psychiatric provider, many places the waiting list is like sometimes 3 or 4 months long.
Wow.
And we're in the middle of a pandemic. So I think people are searching for answers, and people are looking for, it's much easier to go on Google or Yahoo or Bing and get one of these programs because it helps you make sense of things. And it's the most linear path to figuring out what's going on with you. It's not formal diagnosis at all. Everybody wants to know what's going on with me. And if you're talking to friends who've been diagnosed with certain things and they tell you what type of things happen in their appointment, then somebody who, I don't think you can blame somebody realistically who doesn't have the appropriate resources to get the right help, who goes to one of these programs because they have to advocate for themselves and they don't have money or insurance.
Right.
So they don't believe that they can even get the proper help. So it's almost, I think these types of things are like a way for people to prevent themselves from like self-medicating or, because you have to have some type of answer to something.
Right.
So the fact that it's there is a good thing. I think the person who created it, whoever, started it up, they had good intentions. Just as healthcare professionals, when we screen for something, we have to have a plan as to what we would do if we find something. You don't really screen without having like a game plan of what we do if something came up. So if somebody does have like severe depression and they think they have it after taking one of these tests online, then it's what would you do next? And that's the thing that I'm still trying to figure out. I'm not sure what should be done when you put out a program like this just for the general public. But I think there were good intentions behind whoever started this.
Okay. Yeah, I think you bring up a really important point, which is it's great if they have the resources or they're able to go and see a mental health care provider, but not everybody does. And so that does make it where, it could be potentially harmful, although it does seem like the intention was positive.
I will say that.
What can you say about the trend on TikTok to take L-tyrosine? It's apparently been nicknamed the natural Adderall. What is wrong with this or potentially dangerous about this?
A lot of things are dangerous with it. And I do want to say that these amino acids and supplements, you could very well take something like L-tyrosine and have, decrease in depressive or, symptoms or, relief from anxiety. I'm not saying that it wouldn't work. A couple of things. So first of all, you shouldn't take, and I tell people this whenever they join my TikTok lives or on Instagram, I always tell them that you should not take any type of advice medically from anybody online, including myself, because I put the stuff out there for educational purposes, but I can't tell you what to do. I mean, it's outside my scope of practice to tell you to lower the dosage on this medication, or that's too much, or that's not an ethical thing that any respectable healthcare provider would do. And at the same time, when trends get popular on TikTok or even online, you have to be careful because so many supplements are going around and people might say, we have this ingredient in here. And then we have to, these people aren't checking to see if it's FDA approved. So I've seen the videos, and unfortunately those videos are the ones that are viral on TikTok because people are always looking for answers. And for somebody who, let's say that they can't take Adderall because of side effects, if they hear about a natural Adderall or something like that, type of person I think that person will naturally be interested in the alternatives because ADHD can be very troubling to live with. I wouldn't recommend anybody ever listen to anything on TikTok, whether it's from a professional or not, because the person who prescribes you your medication or the person who has done like the full evaluation on you, that's the only individual who can, tell you what to do legally, medically, ethically. So I always say be very careful with anything that you read online.
That's so good. I completely agree. So what exactly is L-tyrosine and how is it different than actual medication for ADHD?
All right. So with the ADHD medications, you have the stimulants. We know you have non-stimulants like Strattera, and then you have the stimulants like Adderall. And in my opinion, I believe that the stimulant options, when somebody can take them, I believe those are some of the most effective medications in all of psychiatry. It's just that there's a lot of people who can't take them because of side effects, and there's a risk of psychosis. And for people who also might have comorbid bipolar, it could be difficult for them. So I think that's how people normally start off with the stimulants, and if it's not working, they either stop taking it or they tell the doctor that they're not going to take it. And then they go on this rabbit hole where you go online and other people who have had the same issues, you go on like a Reddit thread, and then you find yourself on TikTok, and then you look into the alternatives. And something like L-tyrosine, to my knowledge, it does help out with, increasing some of the neurotransmitters, and it can help out with mood as well. But it's not, and I looked at some of the research. I couldn't find studies that were as strong as, the ones that back up the stimulants and non-stimulants with L-tyrosine. And it can be helpful. I don't want to say that it's not helpful. Like, I do believe that you can take L-tyrosine and you have some benefit. Mm-hmm. And I'm sure there's people out there who are using it every day, and it's helping them. It's allowing them to be more alert and focused. And then it's cheaper to do that than to go get an appointment. So they tell their friends, and somebody who's desperate or somebody who's really struggling, I just believe that they're going to look into it anyway. But I just don't think that me personally, if somebody's coming to the office with ADHD, and we're talking about adult ADHD right now, is stimulants or non-stimulants, along with therapy, lifestyle modifications, and things like that. And if an adult comes to the office, I know Strattera is the only non-stimulant approved for adults. And for kids, we can try things like Clonidine or Intuitive. Like, I would rather try some that we use for kids for adults before I go all the way to L-tyrosine, because it's just not enough, in my opinion. But like, whenever people come in my live and say, I'm doing this or I'm doing that, I can't tell them that don't do this, don't do that. But I'll say, hey, if you've seen some studies I'm talking about like a meta-analysis, randomized control trial, so something that is legitimate, if there's a strong level of evidence that supports it, then I'd be interested in it, because I have a lot of patients who want non-traditional methods of relief from ADHD. But if I talk to my other friends who are providers and I can't find evidence that is telling me that, this one amino acid is going to outperform like an Adderall or a Ritalin or something like that, then I can't vouch for it. But I do believe there is some therapeutic benefit to it.
That's so interesting. And I love that that's your response, that you keep the communication open, the conversation open, and invite people to refer to the science, to the scientific peer-reviewed articles that have been published and studies that have potentially made comparisons. And that's great that you continue to help the general public to focus on that aspect. I think that's important. That's great. And so we touched on this a little bit, but what is dangerous about the trends for taking 5-HTP supplements on TikTok? There are several accounts where people make false claims about it, and it's very popular. They encourage people to take it, even suggest forms of self-medicating and adjusting dosage. Like, they'll say, this is what works for me, this specific dose and this many times a day. And then they also suggest including other supplements with specific doses like GABA, as we mentioned, L-tyrosine, taurine, L-glutamine, almost like this whole concoction of these supplements and these amino acids. Would you consider this to be misinformation, and why is it potentially harmful?
So the term misinformation is an interesting term, because like, you could look at, two people could look at a study and somebody could feel like a study is not strong enough, or one person could think that it's amazing. And depending on how you feel about it, you could label it as, misinformation. So I'm not sure whether it would be misinformation, but in terms of how beneficial it would be, I'm not sure how effective it is. And I have seen some studies though that show that 5-HTP, and of course, like, that's a precursor to, serotonin, and with the antidepressants, the SSRIs, and even with the SNRIs, there's always like a component of the reuptake of serotonin. So people, look at that and say, okay, if Zoloft is like this, then 5-HTP should be like this as well. But the only thing is, you're not getting it from a licensed provider. And even with take the antidepressants, for example, like, you have the black box warning for young adults, individuals. Sometimes you can have an increased suicidal ideation and things like that. So that's why we'll say come back within a month, come back in 2 or 3 weeks, make sure that the medication is working, maybe adjust the dosage, maybe take you off if you're having like really bad thoughts. So if you're using natural methods to increase serotonin, then then it can get dangerous because you run the risk of serotonin syndrome. And then like I've seen, and you don't know what other like people, you'll take this stuff and then you don't know, you're not sure that your other meds consist of. You might be on other serotonergic medications. Let's say you're taking Ultram for pain and you don't know that like that's serotonergic. So it's just like, when I think about it, for like somebody like myself, I didn't come from, I had to work really hard to make something of myself. And I come from a family where we grew up on, food stamps and we weren't privileged financially. So I remember how we used to go to the ER sometimes for like small minor cuts because we didn't have a primary care provider.
Yeah.
So, and I feel like that, I remember it like it was yesterday. So I see why people like, it makes like, if somebody tells me that they're going to try this, I'm not going to say, oh, I don't think I'll say, I understand why. Like I would say maybe talk to a professional first, but I totally understand why somebody will take these 5-HT supplements and to help them out. I just say that if you're going to introduce something into your body, just do it with a professional.
Right. Absolutely.
Because the meds that we give, we have evidence behind it. And then even then, sometimes those don't work. We have to try different things. So it's just best to, and I think also one thing that I tell people a lot on TikTok, like they'll ask me questions. I don't know why they feel comfortable to ask me, but they won't ask like their personal provider, their doctor, PANP. Hey, I don't take my meds because of like sexual side effects or whatever. So I want to try this supplement. But if you were to tell like your provider that, I think it's better to have that open communication with them and get their thoughts on it, because more than likely, I don't think they'll, like prescribe you like anything outside of what the evidence supports, but at least for them to be acknowledged, because I do believe there is some therapeutic effect to it, 5-HTP, like the evidence does show that. It's almost, not to get too off topic, but it's similar to like with psilocybin. There is some evidence that it is therapeutic, but it's just not to the point where you can come in and we can prescribe like a certain milligrams of this and that. So just people need to feel like they're being validated and heard. But at the same time, you don't want to set people up for failure too.
Absolutely. What about L-tryptophan for improving sleep? That's been another big trend on TikTok. Is there anything wrong with this assumption?
Not necessarily, because I remember every like Thanksgiving season, they talk about the tryptophan being in the turkey, and that's why you're sleepy. And the science does show that. But in terms of like you taking it to help you sleep, I'm not sure if it's in terms of a long-term strategy, how effective that would be. And a lot of people, I just started to see, tryptophan recently on TikTok trending, because once again, people are desperate and they're looking for different things to help them out with insomnia. And if you have ADHD and you have insomnia as well, then it's like a very wicked cycle. You're operating on like a few hours of sleep, and then you're already having trouble regulating your, emotions, your attention. So sleep is important. So tryptophan, I do believe it can be helpful. There is a relationship between tryptophan and melatonin, but in that case, we tell people to stay off their phones late at night, so that way, they can produce melatonin naturally. And I think with insomnia, like the fewer medications, the better. The fewer supplements, the better. Like I've always felt that way with insomnia. And sometimes for example, like if you have ADHD and you're taking stimulants, if you take it too late, you'll have insomnia. So I do think that there's some people that I've seen them use the supplements, the tryptophan supplements, and they swear by it and they say it's helpful. I think that, once again, I do think there is some benefit to it. But I haven't seen any studies that make me feel comfortable, because the way I know that I'm comfortable to recommend to a patient, like in real life practice, is if like I've seen like a strong level of evidence and I'm talking to my colleagues and they're like, okay, I think I might want to introduce this into my practice, but it's not something like if somebody came in and they had insomnia, I wouldn't recommend tryptophan for them. I would more so talk about sleep hygiene, if anything, like melatonin, and even something like Benadryl, which I think, I used to work in an inpatient setting, so we used Benadryl for years and years. But Benadryl has not been that, benign, because like there's been studies that show that long-term use of Benadryl and the acetylcholine blockages can lead to cognitive deficits over time.
Right.
So like you can take Benadryl for years and like it technically puts you like a higher risk for dementia. So I've always felt that in terms of like insomnia, the fewer pills, the better. So if you can take off a pill or if you can adjust the timing of a pill. But if somebody were to come in, like melatonin, I think is better than tryptophan. In my opinion, that's just my personal opinion. So if tryptophan is a precursor to melatonin, why not just give them the melatonin? But I think when something new comes up and when people, if not TikTok being the way to gain virality online, if you watch a TikTok video and somebody's saying that they couldn't sleep since the whole pandemic and they started taking these tryptophan supplements and now all of a sudden their life has changed, it's going to get a lot of people very curious. And after 5 million views, like you'll see people in the comments, like I read through the comments as well. And people will say, oh, I tried this and it's working great. Somebody who is struggling with insomnia, I think they'll naturally be very curious. And because I'm a realist, I know people are going to go out and do their own experiment, and I won't, judge them for it. But once again, I'll always say, please follow up with a legitimate medical provider before you do so.
What are your thoughts on the TikTok trend to drink chlorophyll water? What does it actually do? Are there real health benefits associated with it that are based on scientific research?
I have not seen a study, and I've not seen a study that made me feel comfortable that you should drink like chlorophyll. And once again, and I spoke to TikTok about this. We had a meeting, I think it was like 2 months ago. It was like educators online. So you had teachers, college professors, you had healthcare professionals, OBs, people from mental health. And we're talking about the fact that if you educate on TikTok, like if I educate, there's going to be somebody who educates like me, but they're not coming from like an evidence-based perspective. And something like chlorophyll, like the research is just there's not enough research that like you're going to feel better, lose weight, be more focused. It's actually pretty scary to me when I see people doing things like that. Like I've seen a lot of, and I was a kid at one point too, and you go on YouTube and you watch like pranks and it's very captivating, but I would really stay away from like chlorophyll. I've seen it and there's just not enough evidence, for it. Like now, essentially it can, I think, help like with inflammation and there's some benefits, but there's no, and then the thing is like, how much of it are you drinking? Are you going overboard? So it's actually a pretty scary thing. Similar to people, I think I saw kids like just pre-workout. People just take scoops and just dump in their mouth with no water. And then I think one girl ended up I think she had a heart attack or something like that. So people don't like understand that anytime you introduce like anything into your body, there's going to be a reaction. So like I would stay away from, like I've seen those TikToks, and unfortunately, the bad thing is that I feel like if you talk about that stuff, you'll go viral much quicker than talking about like evidence-based information, because like if people go to the doctor or whatever, they'll hear what, I say, or they'll hear what NEI promotes, and people already know that. So it's like when you don't want to hear a certain thing, you're going to go to the person who is on the same page with you. They're telling you that, hey, try this out. It's going to boost your immune system. You're going to feel better. It's going to improve like your mood and concentration. And for the person who is desperately searching for something, they're going to try anything. And the bad thing is a lot of times, like there's people who will use like chlorophyll or whatever for years and years, and they'll be fine. And then they'll recommend it to the next person, might not do as well on it. So it might be benign for one person, but
Right.
you don't know how you'll react to it. So you can't just say that, oh, it's safe for me. No, because you don't know how your body will react to it.
We all have different physiology and different neurochemistry to a certain extent. And I could definitely see that. I think that's a really important point to address, that whether or not these people have credentials, what works for one person isn't necessarily harmless for someone else. And that's what gets so dangerous, is that when it goes viral, it's like everybody just jumps on board and they don't think about, and then it seems like if they find something that seems good, then they go overboard. That's what the TikTok trends seem to show, like just gallons of chlorophyll water. It's whoa.
And the thing is, people have a hard time doing anything in moderation. So like you're going to throw your electrolytes off. I see it. And obviously like now being a healthcare professional, I'm mortified by it, but like 18-year-old version of myself, I would be fascinated and very intrigued by it, because there's nothing like having to just, being able to bypass like medical care and do something on your own. People can try it today. It'll take you 3 months to go see a psychiatrist. This in the country with inequalities with healthcare, and that's a much bigger topic or debate. But and anytime people ask me, I always want to make sure that I show that I don't want to judge somebody who does choose to resort to alternative methods, because it can be helpful. If somebody comes to me and they tell me that, tryptophan or chlorophyll will help them out and they're no longer depressed and no inflammation or my skin is better, I wouldn't say, or I wouldn't even think to myself that, I think they're lying. Like, they very well could be telling the truth. But there's a reason why the things that we give to people on a bigger scale, like the meds that we give, these meds have been tested and tried for years.
Right.
There's so much data that supports its efficacy. And then at the same time, like, we also know about the side effects of, these medications. So we know what to expect. We know when to stop it. We know when to adjust and things of that nature. So I wouldn't recommend my family members to drink chlorophyll. So I wouldn't do that for anybody else.
Okay. Yeah. Yeah. And is there any research that suggests that chlorophyll water is beneficial for mental health? I wasn't sure about that, but are they making claims about that on TikTok as well, or is it just overall health in general?
So I more saw, for the most part, saw people were saying that it would help you out with like inflammation, like your immune system, help out with memory, not mental health, like specifically, but people were saying that, it's going to help you. Like, you're going to have the best skin, no longer nauseous. Like, it almost seemed like it was like a one size, fits all type of a thing, but if indirectly, assuming it helps you out with, let's say it helps you out with like your immune system, if you feel better and you feel stronger and if your skin is clearing up and you don't feel like you're nauseous, like if you have improvement in your medical symptoms, that will improve your mental health. So maybe indirectly there's some benefits, but it's scary. It's scary to think that people will actually listen to advice like online. So that's why I even say, even with what I put out, still fact check, the things that I talk about, or still talk about it to your provider, because people will come on like a TikTok live and they'll ask a question and you have 2 or 3 lines to write your question in there. There's no way that anybody can know the right answer from 2 or 3 lines without doing like a full out psychiatric evaluation, without getting collateral information. So the fact that somebody who's like a self-proclaimed guru can tell you that you should try this only based off of their anecdotal experience, that's is mind blowing to me.
Me too. What are your thoughts on the TikTok claim that intermittent fasting, quote unquote, heals anxiety and depression?
This one is tricky because it wasn't until I got on TikTok that I realized how many people, there's a high prevalence of eating disorders, people struggling with weight, disturbed body image, and people are always looking for like a way to lose weight fast. That's the thing. People, if you look on TikTok, like they at least have the hashtag what I eat in a day. And sometimes people would use that and talk about what they eat in a day. Some people obsessively count calories. It gets pretty intense. So when you look at the intermittent fasting, once again, like more like if there's any benefit to it that I can think of, like the discipline aspect, that's what I like about the intermittent fasting. Like the fact that you have discipline and you say, okay, I'm going to set out to do this and I want to eat at this time or eat at this time. From that perspective, I think it can be helpful. But at the same time, like if you're robbing your body of nutrients, you're not eating appropriately, or you forget to eat, once again, your electrolytes can be thrown off. And if you don't know what you're doing, a lot of people can seriously be hurt by intermittent fasting. I don't think it's as benign as people make it out to be.
Mm-hmm.
It can be a really serious issue if you're obsessively counting calories and then you're like, oh, I need to lose this amount of weight by this time. Mm-hmm. So I think, of course, anybody who wants to try it, you should definitely just do it in conjunction with the advice that you have received from your healthcare provider. But I do think you can use some form of intermittent fasting to have like positive health outcomes. So I do believe that. I don't want to write it off, but I don't see people have a lot of boundaries online, honestly. So if somebody's looking up, if you're on the intermittent fasting side of TikTok, there's a good chance that person is trying to, lose weight fast. They have, they don't see themselves in a good light. And like the lens that they will go to, they'll go to great lengths just to do anything. Intermittent fasting, I've seen people talking about using stimulants because they stifle your appetite to lose weight. So, anything on TikTok, like whenever I see like a TikTok trend with intermittent fasting or something like that, I get a little wary because, I don't know the average user age on TikTok. I'm not sure, but if I had to guess, I would say it's probably between 14 and 19, Gen Z, as they call it. I would say they dominate the platform. And they're so impressionable that if you take a teenager who is trying to fit in and you tell them about intermittent fasting, like they probably won't understand how to go about it properly. So I think if you have some form of plan and is in conjunction with your healthcare provider, you could use intermittent fasting appropriately and it can lead to a lot of benefits. I love the discipline side of things from a mental health aspect, and also just like benefits from eating at a certain time, not eating too late. Anybody who is intermittently fasting is mindful of their relationship with food if you're doing it properly. So I think that you can do it properly, but based off of what I know about the app and how things, like if one video, somebody posted it like as a joke, you might log on the next day and that same video has 17 million views. And then everybody in the world is seeing it. And then people are going to get curious and people are going to try it. And they might turn it into a prank or a trend. So I would, of course, fact check everything with your doctor. But it's one of those things, just like with the chlorophyll, the tryptophan, like one person could do it and have good benefits, but somebody else could try it. And like I said, the first thing that came to my mind is people with, eating disorders. Like if that person tried to intermittently fast, it wouldn't, like, I don't think that would be the most ideal. I'm trying to pick my words carefully because I don't want to seem like, I'm judging somebody for why they do something or telling them not to do. I don't take their autonomy away, but especially if you have a eating disorder or if your relationship with food is disturbed, then I tend to worry about the whole intermittent fasting thing.
That's such an excellent point. And there has been some research, as you've been pointing out, in terms of some health benefits, some mental health benefits with intermittent fasting. And so I think you already touched on this, but this is my last question for you, which is what does the research actually suggest about potential mental health benefits from intermittent fasting and what's fact and what's fiction? And I think you address the point of what can be harmful about intermittent fasting is, once again, not looking to the research, not looking to the studies. And when you have potentially adolescents with potential eating disorders, this could become harmful or dangerous, especially when you add in the fact that they aren't necessarily aware of how to do a proper or a intermittent fast. I know that there's things out there like a supported fast where you can have chicken broth and things like that. And there's a lot of information that suggests scientifically it could be beneficial for mental health. So is there anything that you can share with us about some of those points and how that's not effectively being addressed on social media platforms like TikTok? It seems like it's more just the fad and people are just doing what they want. And then again, it could become dangerous, especially if someone has an eating disorder. They don't eat for several days and then they say they're in intermittent fasting.
With intermittent fasting, I think there's a lot of aerobic benefits, like for somebody who's an athlete. And if you're doing it properly, you can, help with your cardiovascular health. And also speaking about, ADHD and memory and focus, there are some cognitive benefits to it. So, those are the health benefits that come to mind when you do it properly. So you're going to be able, if it's done properly and you know what you're doing and you ran through everything with a licensed professional, you could have better benefits with your athletic activities. If you're somebody who, like, let's say there's hypertension in your family, or like it could be something that you might want to look into, provided you went, ran through by a healthcare provider. So I think of heart health, cardiovascular health. I think of helping out with your cognition, memory, focus, and also the discipline aspect. I think is very empowering mentally, because you put your mind to something. When you say that you're going to do a certain task and you do it, that improves your confidence because you're doing the things that you set out to do. Right. So I think from a discipline perspective, if assuming like this is all done in a good manner and you know what you're doing and you're doing things for you, because we all have different caloric needs and everybody's body is different. But I do believe that you can use forms of intermittent fasting to greatly improve your health. So, depending on the person, obviously, but if it's done correctly and the health benefits of intermittent fasting, I wanted to make sure that when I talked about the benefits that I didn't say the reduction of weight, because a lot of people focus on that. Oh, I'm going to intermittently fast. I'm going to lose weight. And if that's your primary goal, then sure. But there's so many more benefits outside of losing weight, having a body size and shape that's good for you, being healthy, being fit, being like, I've seen people who are technically overweight by BMI standards, but like they could run, 2-3 miles, like without stopping. They can play basketball, up and down, soccer, like without having to like get super tired, because like they're in good shape, like aerobically. So those things can help out with intermittent. Those things can be helped out through intermittent fasting. And as a byproduct, if you're doing these things, if you're disciplined, if you're being mindful of what you take in as a byproduct, you will lose weight. But I guess the goal is not to hyperfixate on that, wanting to lose weight, because if that's what's going on, then there's probably like more issues beneath the surface. Right. But there are a lot of cardiac and health benefits to intermittent fasting when done correctly.
Thank you so much, Dr. Sarfo. And it was wonderful having you on our show, especially when it comes to this topic. This has been such a great experience just discussing the importance of this topic with you.
I appreciate it. Thank you so much for having me on. A blast.
This episode was brought to you by NEI Membership. The 2021 NEI Synapse Virtual Half-Day Series is included with NEI Membership. Become a member today so that you can register for free. for any or all of the monthly half days, in which Dr. Stahl and colleagues will spend the last Saturday morning of each month sharing cutting-edge research and clinical insights on the topics most relevant to real-world practice. Don't miss out. Become a member today. Visit www.neiglobal.com to learn more.